Hey folks, today we are going to discuss about pyogenic granuloma, commonly heard as pregnancy tumor. I bet you must have seen many cases of pyogenic granuloma because it is a common lesion commonly seen in young patients and female patients. But if you wonder how it is diagnosed and treated, this video is for you. Hi, I am Dr. Neha, your maxillofacial physician and radiologist. I usually discuss about few of my cases, my interesting cases in this series of video, and today is the case of pyogenic granuloma. At the end of this video, we are going to discuss about the significance of this case. So stay tuned till the end.
So this is my patient who is 48-year-old. Now pyogenic granuloma is commonly seen in young patients and pregnant women, but this is an older age case. She came with the complaint of growth on her gingiva since 5 to 6 months and she's finding difficult to eat due to the impingement.
This growth gradually increased in size with no history of pain, pus discharge or tooth mobility in the associated region. Her menstrual cycle was normal. Taking history of menstrual cycle is important as pyogenic granuloma can also be influenced by hormones. Patient's oral hygiene was poor as she was an areca nut chewer. This patient gave us a very interesting history of similar growth of smaller size in the similar region which exfoliated on its own.
On examination, you could see a pedunculated growth which is red at the base and somewhat blanched at the inferior end. The size of growth was 3.5 into 2.5 centimeter. Tenderness was absent, and on provocation there was pus discharge followed by bleeding. Now, keeping in mind the differential diagnosis of pyogenic granuloma, which are peripheral giant cell granuloma, peripheral ossifying fibroma, capillary hemangioma, few diagnostic radiographs were taken. Now, this is a periapical radiograph of affected region showing mild to moderate bone loss indicating periodontitis. Now, this is an interesting soft tissue radiograph of the growth to see whether there is any calcification to rule out ossifying fibroma, and we found none.
So after all the diagnostic procedure, we headed towards the surgical procedure and we conducted basic blood investigation protocols. All the blood reports were normal and we got the green signal for the surgery.
Surgery was conducted under local anesthesia. The growth was excised, flap was raised, a thorough curettage and root planing was done, area was sutured, and the specimen was given for histopathological examination.
Now, one thing you should keep in mind that the pyogenic granuloma has two histopathological variants. First is the lobular capillary hemangioma and other is the non-lobular capillary hemangioma. The lobular capillary hemangioma is associated with the sessile growth while the non-lobular capillary hemangioma are associated with the pedunculated growth. And in our case of pyogenic granuloma, the histopathological report was a non-lobular capillary hemangioma.
So this is the post-operative picture taken after 3 months showing no sign of recurrence.
So that's it folks, it was all about my case, and next time you see a pyogenic granuloma case, I'm sure you're going to confidently diagnose it. And even if you're not, you can always refer it to a maxillofacial physician followed by a maxillofacial surgeon who can diagnose and surgically treat it respectively.